Hello, this is KMRS-KKOK. I'm your news director, Marshall Hoffman, and we're going to talk a little public health today from Horizon Public Health. I have got Kelsey Peterson. How are you, Kelsey?
Hi, I'm good. How are you?
Good. You were just telling me you're from this area,
I am. Yep, born and raised in Morris.
and what are your duties there at the Horizon?
I work as the disease prevention and control and emergency preparedness supervisor, and I oversee all of our programs that go with infectious disease and prevention.
You must be busy these days.
Very busy, yes.
Well, let's talk about some of the updates about the COVID-19. We have. Let's talk about boosters first. People have a lot of questions about who's eligible, when can they get it, what's the situation here in our service area.
Yeah, so as of October 21st, boosters became available to everybody. Through Moderna, Pfizer, and Johnson & Johnson, there are select criteria for people who are eligible for booster. You need to be either 65 years of age or older, living in a long-term care setting. You can also be, if you're 18 or older and have an underlying medical condition, you would be eligible for a booster dose, as well as if you live or work in a high-risk setting. And so for Moderna and Pfizer, you can get a booster dose 6 months after you received your second dose of the Moderna or Pfizer vaccine. And then for the Johnson & Johnson vaccine, you can get a booster dose if you're 18 or older 2 months after your first dose.
And I think it was announced that you can kind of mix and match these. You don't have to, if you had Moderna before, you can go ahead and have a Pfizer.
Yes, you can. You can interchange them for the booster dose. You can. It really comes to what your preference is. There's a couple different risk factors that some people have chosen. Maybe they had the Johnson & Johnson the first time, and they feel like they would like to switch to Pfizer or Moderna. They can do that. So there is that flexibility.
That's kind of unusual, isn't it? And you don't often hear that mix and match kind of thing.
Yeah, not always. No.
And there's plenty of it available, correct?
Yes, it's readily available.
People should just contact their health provider.
Yep, they can go to their health provider. They can go to their clinic, pharmacy, or local public health. It varies on what each facility offers, but you can most of the time you can go online or you can call whichever facility you'd like and get that appointment scheduled.
And Horizon's doing it as well.
Yes, we are.
And you've got 5 counties in your service area. Why don't you remind people where those counties are?
Yes, so Horizon Public Health is comprised of Douglas, Grant, Pope, Stevens, and Traverse counties.
Very good. Now, another thing that's just come down the pike, vaccines for elementary school children. That's just kind of rolling out here. How is that going to be playing out in our area?
Yeah. So this past week, the ACIP, which is the advisory committee for the Centers for Disease Control and Prevention, they just voted, and then the CDC director endorsed vaccinations for 5 to 11-year-olds. And so within the next couple of weeks, there is a different formulation for 5 to 11-year-olds, and so that formulation is going to become available, and many providers and facilities have ordered that vaccine to be available in the next couple of weeks. And so when that does become available, I know that our local clinics will have that available at regular appointments that they can sign up for. And then local public health, we will be setting some dates as well in the near future, probably towards the end of November, to offer vaccinations for those younger youth.
Because there actually have been like thousands of children who have been tested positive for COVID.
Yes.
And I forget the number. Quite a number have been hospitalized too, if I'm not mistaken.
Yeah, I don't know the number off the top of my head, but yes, there has been many. There's been about 25% of youth who have been hospitalized due to COVID who have not had any underlying medical conditions.
Right. And we're still researching what the long-term effects are for these illnesses.
Yes, we are.
Okay. And then what else is on the COVID front that you're watching?
You know, we continue to watch active cases. Those are some of the things that we look at to see what's happening in our region, in each of our counties. We look at our hospitalization and ICU trends. That's really a key tell factor of how active it is occurring and spreading in our community. So looking at those hospitalization and ICU numbers, we do get a lot of calls on people wondering about how they should isolate, how long they should be isolating for. as well as quarantine if they've been exposed to COVID, what they should do. So a lot of calls from the community, and we just try to discuss with them and brainstorm their specific scenario and how they can overcome that.
And quarantine depends if you're vaccinated or unvaccinated, right?
It does, yep. So if you have been vaccinated, you don't need to quarantine. But if you have been I should clarify. If you have been vaccinated, you would not need to quarantine. But if you have not been vaccinated, you would need to quarantine. And the recommendation is 14 days.
And what are the statistics here for people who are vaccinated versus unvaccinated as far as hospitalizations and serious consequences of COVID?
Yeah, so the majority of the cases that we are seeing of people hospitalized in our region, the majority are unvaccinated or at this point ineligible to be vaccinated. So when I say ineligible, they are too young to be vaccinated. So the encouragement is that people get vaccinated. It prevents severe COVID hospitalizations and death.
And there's still incentive programs, aren't there, for people to get vaccinated?
Yes, there is. There's actually a incentive program occurring right now for 12 to 17-year-olds. If they get vaccinated and have their full series completed, they would qualify for a $200 Visa gift card, as well as the opportunity to win 5 different Minnesota college scholarships, and that would total each of those scholarships is $100,000.
Us early adopters get nothing, right?
We thank you for getting vaccinated.
Thank you for your service.
Yes.
Yeah, okay. Got it. And then also we've got the testing site up here in Morris that opened up at the Armory, or I should say reopened up. How are things going with that?
Yes, things are going very good there. It is open Monday through Friday, 11 a.m. to 6 p.m. You can schedule online or you can walk in and get vaccinated, and get tested. And they offer saliva testing there, so those do get sent out, and you should have your results within 1 to 3 days.
Do you know what kind of numbers they've been getting?
You know what? We're working on connecting to get those numbers. Since it did just recently start, we haven't been given the total numbers on a weekly basis yet, but we will be getting those numbers soon, and I can share those with you when we get them.
Yeah, I'm just wondering if they're very busy there
Yeah.
or how things are going when that. What else should we keep in mind here as we head into the winter season? How is that thing's going to play out with COVID and intermingling with the flu that's out there?
Yeah. So we have been looking at some data. The Minnesota Department of Health, every week they put out data that shares different viruses that are occurring and spreading in our communities. And we have seen an increased amount of influenza cases as well as RSV. And so some of those numbers are significantly higher. For RSV, for example, during this time in comparison to the last 4 years, around the end of October, those numbers, the RSV cases are double what we've seen in Minnesota the last 4 years. So it's really important to get vaccinated, to keep your children or yourself home when you are sick. We don't want to be spreading things to others inadvertently, and keeping ourselves safe. Some of the mitigation efforts that we had in place last year, such as extra hand washing, more distancing, wearing your mask when you're in public or in indoor settings, those were really important and really helped lower the severity and cases that we were seeing for COVID, as well as these other viruses that normally occur in our community. So it's really important to use some of these mitigation efforts when they're needed, especially during this upcoming season.
How do you know? Well, what's the difference in the symptoms between RSV and COVID? Because they're kind of similar, aren't they?
Yeah, some of them are very similar, and depending on how a person responds to it, they could almost mimic each other. So really, what it comes down to is staying home and getting tested to really identify what the source of the virus is, so that you can get treated appropriately for it.
If you go to a COVID testing site, though, they're not going to say, "Oh, you don't have COVID, but you've got RSV." That doesn't do that, right?
Right. No, it does not.
So check with your healthcare provider again.
Mm-hmm. Yes.
All right. And if I recall, last year, like during the school season, the numbers of influenza or flu were down because of the masking policies were in place. That was kind of a side effect, I guess. Do you think that would help this year if the students were masked indoors in the winter?
Yes, most definitely. It would definitely impede and slow the transmission that we're seeing for COVID, influenza, RSV. It would definitely help in all those factors. Especially with the mitigation efforts that were in place last year, those numbers were readily low, and children were healthy, people were healthy, and now we're seeing just cases rise in all areas. So it's definitely something that could make a difference and keep everybody healthier.
Okay. Any final thoughts you want to add about where we're at with COVID or what people should be doing?
Everybody, I guess I would just say that it's good for everybody to do their part. Stay healthy, stay home when you're sick, get the vaccine when it's available to you, and just do your part in keeping our communities healthy and safe.
All right. That's Kelsey Peterson with Horizon Public Health. Thanks so much for being with us here on KMRS and KKOK.
Thank you, Marshall.